Hello, hi, this is Dr. Erica, pharmacist for close to 10 years now, owner and founder of Millennium Pharmacy. Thank you for joining me on this particular channel. Please subscribe, like, and share as well. This particular channel is educational. It's for medical students, for pharmacy students, for those out there who want to understand their medication therapy a little bit better, who would like to comment and ask questions about how best to take medications that are over the counter, medications that are prescribed. So please subscribe to this channel for new and updated content. Also subscribe for better content, research content as well. I would like to do more collaborations with other healthcare providers that use platforms such as YouTube as well, and also possibly podcasting. So please let me know. Also visit my website. I have a website, www.millenniumpharmacy.com, www.millenniumpharmacy.com. Please visit that website as well. Now, this particular video, I'm just going to give an overview of some medications that are used for angioplasty. Angioplasty is a surgical procedure for atherosclerosis treatment. And there are medications that a patient will receive before they actually undergo the procedure, just because it's an emergency situation where the patient comes into the emergency department and doctors have to come in together, pharmacists as well, to actually help prevent a heart attack. So the earlier the treatment starts, the earlier the detection of ischemic or oxygen depleted tissues of the heart, then the better the outcome, the less the mortality for the patient. So first, a patient will receive oxygen if they have an oxygen less than 90%. They'll also receive a aspirin. Also, they'll receive nitroglycerin to help prevent pain of the heart, also chest pains as well. The aspirin will help reduce blood clotting that is possible because the coronary artery is blocked, and so blood cells can become blocked. If they become blocked, then the blood cells can possibly form clots and move along the walls of the arteries, causing a heart attack or possibly a stroke. So we want to prevent that. Now, we also want to give the patient not only aspirin, nitroglycerin, and oxygen. We want to make sure that they also have on board a stronger anticoagulant to help thin the blood cells from actually coming together to cause a stroke. So once that anticoagulant is in place, that'll help break up any clots that could possibly form in the blood around the heart, as well as the coronary arteries around where the plaque is accumulating. Also, we want to give Plavix, or we want to give a fibrinolytic, which is another blood thinner. It works in a different way. It helps prevent the coagulation of platelets that's in the plasma. And then also we want to give pain medications if needed, stronger pain medications like morphine. So it just depends on the particular case, but usually within the first 12 hours or as early as possible, we want to go ahead and get those medications on board. Now, after about 12 hours to 24 hours within that first day, a patient will receive an ACE inhibitor or an ARB to help lower the cholesterol in the body, LDLs particularly. Also, the patient will receive nitroglycerin, a beta blocker as well, such as bisoprolol, or also carvedilol, or also they may receive a metoprolol, which helps reduce mortality. These beta blockers will help control the heart rate, help control the heart rhythm, and get the patient in stability so that they don't go into a heart attack. Also, they may receive aldosterone as well, which is like a diuretic to help with getting fluids off of the heart. And if that is the case for the patient, each case will be different. But if the heart is dealing with fluid overload or ventricular overload, then definitely the patient will have to have a aldosterone on aldosterone on board, a beta blocker, also a thiazide diuretic will help rid that as well. Now, upon discharge, a patient will be discharged not only with maintenance medications such as statin for cholesterol, but they'll also be discharged on medications such as nitroglycerin, beta blocker, all the medications that are used during hospital stay to keep the patient stabilized. Once the patient is stabilized, then they're welcome to go home on each stabilized medication, which is what we prefer as healthcare providers to prevent further destruction on the heart. Also, if the patient is a tobacco user, we ask that the patient go home on medications that help with preventing um, um, tobacco problems, such as again, hypertension, bone mineral density decrease as well, and risk and blood coagulation or atherosclerosis. So we know that tobacco or nicotine does cause these problems, and we so want to deal with them ahead of time and after discharge to make sure the patient doesn't have to be hospitalized for the same reasons, and also to reduce the risk of mortality. Now, each patient's case, again, is different, so a patient may or may not receive all the medications I've mentioned in this video. They may receive other medications instead, and they may not receive all of the medications I've mentioned. Now, there are some blood thinners such as the Plavix, Effient as well, or Plasugrel that are indicated as blood thinners that inhibit platelet aggregation. And some of those, they irreversibly block some of the proteins, reducing platelet activation and aggregation, which is very important at this particular point. Because the patient is experiencing heart pain or chest pain, they are at risk for also going into further myocardial infarction episodes, especially if they have an ST segment extension, which is the EKG diagram. If you look on the EKG diagram, the ST segment may or may not be elongated or extended. So if that is the case, then definitely we want to go ahead and initiate all the medications plus oxygen that I've mentioned, because they are at risk for a myocardial infarction at this point. So thank you for joining me on this particular video. I want to make sure that it is understood that there are several medications that are utilized during this particular emergency visit for a patient. And also the patient can also, if they're a smoker or if they have a history or family history or genetic history for myocardial infarction, then definitely we want to make sure that they are placed properly on medications and know what medications to expect as well. And there are guidelines from the American College of Cardiology and the American Heart Association that backs the guidelines and algorithm for which medications are administered and the timeline at which they are administered as well. So thank you for joining me on this particular video. I hope that you like, share, and please subscribe. Thank you and have a great day. This is Dr. Erica signing off. Bye-bye.